Hi everyone, in this video we're going to talk about how the kidney regulates blood pressure. So just some terms to know. The glomerular filtration rate, sometimes abbreviated GFR, is simply the rate at which filtration happens. In order to have a glomerular filtration rate, in order for filtration to happen, you need a certain amount of pressure in the afferent arteriole / glomerulus. And the reason for that is, just to illustrate with a simple example, if you look here on the right, so you have a coffee filter. And inside you put your coffee beans, your crushed coffee beans, and then you're going to pour some water on top. And of course, your coffee will drip into whatever container you have. Your coffee with the water will drip into it. But if you think about it, what's pushing the coffee through the filter? Here's something that's applying a force and pushing it through, and that something in our case is gravity. Gravity wasn't pushing your coffee or applying a force to your coffee, it would just kind of sit there, or it wouldn't even sit there at all. But if you try this in outer space, it just wouldn't happen. So it's the same kind of thing with the nephron. In order for filtration to happen, you need there to be a pressure that's pushing blood through the afferent arteriole with a strong enough of a force that it'll cause substances to leak out into the bone's capsule. So in order to make sure that there is enough, in order to make sure that blood pressure is at where it's supposed to be, the kidney has what's called, or the nephron has what's called the Juxtaglomerular apparatus. This apparatus will make sure that blood pressure is where it's supposed to be so that filtration is happening properly. So I drew here an illustration, or I drew here a picture of the nephron, but I drew it in a more 3D way so that you can see that at some point the distal convoluted tubule crosses paths with the afferent arteriole. That's our afferent arteriole. And this other arteriole over here, that's the efferent arteriole. That's the arteriole that will take blood away from the glomerulus. But in any case, this picture might look, it might be a little confusing because you're probably remembering the nephron stretched out, but really it's a 3D structure, and at some point the distal convoluted tubule and the afferent arteriole meet. And to your right, I just enlarged that area. So here we have that spot where they cross paths, and in this spot we have the juxtaglomerular apparatus. So what makes up the juxtaglomerular apparatus? Cells in the afferent arteriole, they are the juxtaglomerular cells. I'm just going to sometimes call them JG cells. And then cells in the distal convoluted tubule in this area, they are called the macula densa. So the macula densa and the JG cells together make up the juxtaglomerular apparatus, and they will both do things. They will work together to increase blood pressure when it's too low. So let's first talk about the JG cells, the juxtaglomerular cells. The juxtaglomerular cells are baroreceptors. If you recall from physics or chemistry, the prefix baro refers to pressure. They sense pressure. So if the juxtaglomerular cells sense a decrease in blood pressure, they sense that blood pressure is too low, they will secrete a hormone, renin. I'm sorry, not a hormone, an enzyme, renin. And renin will begin a cascade that will lead to an increase in blood pressure. So let's talk about that cascade. And these names are a mouthful. So renin will cause the conversion of angiotensinogen to angiotensin 1. So renin catalyzes this reaction. We're going to write renin right here. And just to remind you, angiotensinogen is just the inactive form of angiotensin, and we call that a zymogen. A zymogen is an inactive form of an enzyme, and you can tell if it's a zymogen by looking at the end of the word. If it ends with a gen, you know it's the inactive form of the enzyme. Okay, so renin catalyzes the conversion of angiotensinogen to angiotensin 1. Then, angiotensin 1 will be converted to angiotensin 2. And what catalyzes that reaction? Well, something else. Angiotensin converting enzyme. Angiotensin converting enzyme will catalyze that reaction. And finally, angiotensin 2 will actually do something about the blood pressure. What will angiotensin 2 do? It'll do three things. Number one, it will, angiotensin 2, number one, is a very powerful vasoconstrictor. It will cause blood vessels to constrict, to become smaller. And maybe you remember from physics, pressure is the force divided by the area onto which that force is being applied. So if you make the area of the blood vessels smaller, in other words, if you decrease their area, since it's in the denominator, that increases pressure. So decreasing the area of the blood vessels will increase pressure, and that's exactly what we want. We need pressure so that filtration happens. The second thing that angiotensin 2 does is it stimulates the release of aldosterone. If you recall from our last video, aldosterone will cause an increase in sodium reabsorption, an increase in salt reabsorption, and if you increase the amount of salt reabsorption, you will increase blood pressure. You probably know people who have high blood pressure are told to stay away from salty foods because salty foods cause you to have higher blood pressure. And the third thing that angiotensin 2 will do is it will stimulate the release of ADH, of anti-diuretic hormone. Anti-diuretic hormone. Again, if you recall from our last video, anti-diuretic hormone will cause the distal convoluted tubule and collecting duct to both be permeable to water, thereby increasing the amount of water that's reabsorbed. If you absorb more water, you will have a greater blood volume. If you have a greater blood volume, you'll have greater blood pressure. Okay, that takes care of the juxtaglomerular cells. And now let's talk about the cells of the macula densa. And just to remind ourselves, again, the macula densa are the cells of the distal convoluted tubule that are in the JG apparatus. Let's go to a spot where we have some room. Okay, let's talk about the macula densa. So the cells of the macula densa are not baroreceptors, but they are chemoreceptors. They will sense a change in chemical composition. If they sense that the blood osmolarity is low, meaning that the concentration of ions in the blood are too low, they will do two things to fix that. Number one, they will stimulate the juxtaglomerular cells to release renin. They will stimulate the juxtaglomerular cells to release renin. And the second thing that they do is they will cause dilation of the afferent arteriole. They will cause dilation of the afferent arteriole. That will kind of cause blood to rush into the afferent arteriole and glomerulus and will kind of increase the filtration rate.